Hello, family. It's always a pleasure to speak to you. It's always a pleasure to interact with you. My name is M. Moody. I'm a medical imaging and diagnostic radiographer with a special interest in ultrasound. And this morning, I just want to speak to you about the role of ultrasound in fertility screening. And I would like to start with the fertility screening in ladies. So what we do on ultrasound is we do an examination called a pelvic scan, and a pelvic scan is a very simple procedure. You just look at the pelvic organs just to make sure that the uterus, the fallopian tubes, the cervical region, and the ovaries are okay. And what we want to check is we want to make sure that there are no lesions, there is no growth, there are no fibroids. We want to look at the fallopian tubes to make sure there is no infection. We want to look at the ovaries to make sure that there are no cysts, there is no lesions on the ovaries, and that these organs are there. Because sometimes you might be born thinking that you have all these organs, but sometimes they're not there. Or if they're not there, they're not fully formed. Sometimes you are born, you think that you have all the two ovaries in your body, in your pelvic region, but that is not always true, because sometimes you are born and either the organs were not formed or they were formed partially. So when we do ultrasound, we'll be able to rule out all these issues, and if they are found, then we'll always be able to at least know what the solution could be. Because it is said that when the problem is found, is a problem which is half solved. In male, we always want to do a pelvic scan, and we also want to do a scrotal scan. Pelvic scan, we just want to look at the prostate, make sure it's not diseased, that there's no problem, there's no infection, there's no growth on the prostate. We also want to look at the seminal vesicles to make sure that they are okay, they're not diseased, and there's no infection. We want to look at the testes to make sure that the testes are there, and the testicle there's no undescended testes. And we want to look at them, make sure that there is no lesion, there's no infection on both the testes. So I think when we do all these things, we'll be able to ascertain if there's a problem, and we will be able to advise the patient whether we will hand the patient with your gynecological team, and the urology team will be able to forge a way forward on how they're going to help you. So if you have an issue, if you're experiencing an issue with fertility, don't fear, don't get depressed. There's always solution outside here. With the technologies, with the information that God has given us, my prayer and my message to you is there's always hope, because with the information that God has released to us, we have been given this information outside here so that we can help. God has given us this, God has released this information to us so that at least we can help our society, we can help people outside there. With the advent of new technologies like in vitro fertilization, no one should worry because he cannot conceive or he cannot have a child of his or her own. Because when with these technologies, we can always help you at least to have a child, to conceive and to have a child who's going to call you a mother or a father. So when we share this information, it's always interesting to share this information, because I know there could be someone outside there who is depressed, who's feeling that he has come to the end of the road. But my message to you is you have not come to the end of the road, because there's always help. There's always help outside there. What you only need to do is to come forth and seek for help. And I'm 100% sure, I'm hopeful that you will find help, and you'll have a family of your own. Once you do all these things, once you do all this screening, and we find out where the problem is, I'm sure and I'm hopeful that you'll get a solution. So kindly share this information, talk to each other, and at the end of the day, my prayer has been that even as we share this information, once people receive this information and share it outside there, people can be helped, and we can have a better society. People will not be hopeless, but people will have hope that there's always a solution on the problem that we're having. Thank you very much. It's always a pleasure to speak to you, and thank you for tuning in. And even as you tune in, even as you share this information, kindly, my prayer has always been that we'll help each other. Even as we share the information, we'll help the information grow, and we'll help everybody outside there, everyone outside there, because you are my brother and you are my sister, and together we can make our society a better place to live in. Thank you, and have a great day ahead.